information I attained tonight's for the baby and child class I got from Gentle Baby's book, which is written by Deborah Rayburn, which this is a fantastic book if you know anybody pregnant, having a baby soon, or small children. Sarah actually used it all the way through her pregnancy, and she's the one who referred me to this book, so really good book. I also use the reference guide on essential oils from the Higleys. It's Connie and Alan Higley, as well as I used the Essential Oils Integrative Medical Guide written by Dr. Young himself. All right, and then a few things to remember when using oils on babies and children is to, most of the time you almost always want to dilute them. Children's skin is way more sensitive than ours, and diluting just ensures that you're not going to have a reaction with the oils. Whenever in doubt, you want to use 1 drop of oil to 30 parts carrier oil. Carrier oils can be anything from coconut oil, olive oil, sesame oil, pumpkin oil. The company also has what's called the V6 oil, and that's just a vegetable oil complex. So if you're having a hard time deciding what you want to start with, you can definitely go that route. But I use coconut oil for just about everything because it's fantastic for your skin, for your hair, for your body in general. So just a little bit of that. And then one thing to also remember, citrus oils are photosensitive, all of them. Bergamot is also a citrus oil if you're not aware. But your tangerine, your orange, your lemon, your lime, your grapefruit, your bergamot, all are photosensitive, which means going out into the sun, then you have a higher chance of getting a sunburn where you applied those oils. And that lasts for about 12 hours. So if you intend to do a lot out in the sun and you use the citrus oils on your skin, try to do it at night before you go to sleep so you're not going to have a reaction during the next day. All right, so at this point I'll go on, and I'm going to be using notes, so bear with me. And this is kind of in alphabetical order, so you're going to see some things that are almost parallel, back and forth, but just slightly different situations, but a lot of them have parallel treatments. So just we're going to start with baby acne and cradle cap. And this is straight from the Gentle Baby's book. They recommend lavender and Melrose, 1 drop of each, and you apply it neat directly to the areas. Neat would be the oil directly on the skin without a carrier oil.
And there was 1 drop Melrose neat?
1 drop Melrose, 1 drop of lavender. And that would be for your cradle cap or baby acne. And then you would just apply it directly to the affected area. So if you have just a couple bumps on the cheeks, you would just dab at them very gently. If it's the cradle cap, you're going to apply it in. Another one was bonding, to bond with your new babies or your children, to create a higher sense of bonding, I should say. They recommend Gentle Baby and Joy, simply by diffusing it or putting a small amount on your hands, and you'd rub it on yourself, and then as you're with your children, they would smell it. It's more of an inhalation type of treatment. Okay, chickenpox and herpes zoster, which is, chickenpox is very contagious. It's a childhood disease. Typically, adults can get it, but it's rare. Herpes zoster is shingles, which is the reoccurring virus in the body that comes back as an adult, which is not contagious. So just so you know the difference between them, this is a treatment you can use for both though. They recommend the Clariderm spray, which is a Young Living product, and you spray it to relieve any itching that may be happening. And then Australian blue, Roman chamomile, lavender, Melrose, Raven Sarah, and it says apply 1 drop of each to the bottom of the feet 3 times a day at the onset. They also recommend the Ningxia Red to drink 1 ounce daily. Raven Sarah, dilute 1 to 1, so that'd be 1 drop of oil to 1 drop of carrier oil. and you dab that on each of the spots, and that helps with itching. And it did also recommend the raindrop technique, which is a technique developed by Dr. Young, and it's the use of 9 different essential oils that are applied to the feet and the spine.
Now that's got oregano and stuff in it, I know. So if you're doing that on a child, do you have to dilute it even more than
Yes.
what you may, because
Yes.
it's so strong? Okay.
Yes, and I use about half the oils on a child that I would on an adult. Because a lot of the oils during a raindrop technique, you're very saturated in oils. You use a lot of them. Depending on the age of the child, we would cut that back quite a lot. There's smaller versions of us. They don't need as much as we do, and there's no reason to use as much. It's just the oils are strong and there's really no need for it. So, but from what I took from the book, this is something that is more for an older child. I would say above 2. Next one we have is circumcision, which is definitely a very hard situation to go through as a parent. I dealt with that with my son. Was not my favorite time in my life. They recommend using the rose ointment that Young Living has, and you apply that to the diaper area, and that actually helps to prevent the diaper from sticking to it as it's healing. And then the animal sense ointment to apply it topically. Pick up your jaws. Animal sense ointment, even though it says it's made for animals, it's made with all the same ingredients that we would use. So it's made to treat common ailments that animals would have, but it's completely safe for us to use as well. And it's good for rashes of all sorts and healing. So it's it's got like I know it's not glycerin, but what is
beeswax, mink oil?
beeswax, mink oil, and it's got a bunch of essential oils. But it's not a gel, but it's like a salve. There we go. That's the word I'm looking for. It's like a salve. So it's got that greasy feel to it, so that would also stop that from sticking to the diaper as well, which is very common with circumcision. Okay, next thing we have is cold sores, which typically affects children a little bit older too. It's not necessarily something many little babies get. They actually had a recipe listed, so they recommend with all of the recipes that they had in the book to use the rose ointment. Now personally I would use coconut oil. It's a little bit on the cheaper side, but it works just as good and it's great for your skin. And most of us have it around the house. So if you want to use the rose ointment, that's an option, or the coconut oil is another option. And you want to have, because this is a 2-ounce recipe, so you're going to have some little tin or a baby food jar, something with a lid that you can seal it up and reuse it again and again. But with 2 ounces of the rose ointment, you're going to combine 2 drops of lavender, 2 drops of melissa, 2 drops of melrose, 2 drops of sandalwood, excuse me, 1 drop of Raven Sarah, and 1 drop of thyme. Now this is for a cold sore. So you're going to apply that directly to the affected area. The sooner you apply it, the less chance it's going to erupt on you. So if the kid starts complaining about the tingling or whatnot before it actually starts to erupt, if you put that on there right away, a lot of times it never comes out to a full-blown cold sore. If it's already starting to blister, it's going to reduce the amount of time that you're going to have that cold sore, help it heal a lot quicker. Okay, for colic, through studies that have recently come through, it appears it is from abdomen discomfort. Now, when my kids were little, they had no idea what caused colic. Now they're finding it's something to do with the stomach, which it was always my guess. That's what it was, because whenever my son would cry, my son had colic for the first 3 months of his life. It was a very hard 3 months. But when he cried, he'd always crunch down like he was hurting so bad. Well, now they're finding out it's abdomen discomfort that causes it, which is a great relief for a whole lot of mamas and daddies out there. So They say the first thing you want to do is look at the mother's diet, especially if you're nursing. You want to remove any caffeine, high fat, or spicy foods, because those are all going to make the baby react. So they recommend Roman chamomile. It'd be 1 drop in a bowl of warm water, and then use a washcloth and do compresses on the baby's belly with the washcloth. Dip it in the water, wring it out, and then do compresses. And then dill, 1 drop with a tablespoon of carrier oil. You're going to rub it in the middle of the baby's back clockwise. Anytime you're rubbing the stomach or the back, you always want to go in a clockwise motion, because that's the way our food is digested, everything in the body, especially the belly. If you do it the opposite way, you can back them up. So always go clockwise. Also, that's also how in energy work, our energy flows through our body in a clockwise formation. So just always try to do clockwise motions whenever you're rubbing. Then digest, 1 drop with a tablespoon of carrier oil on the abdomen. Now this next one is one that's gonna kind of be just the opposite of what this paper I gave you said, which is part of the reason I said I don't necessarily agree with this, because I also have another reference here that is saying it's okay. So you gotta kind of use your best judgment on this, okay? But for congestion, they recommend Eucalyptus globulus, Eucalyptus radiata, RC, which stands for respiratory care, and that has 3 different types of eucalyptus in it, plus a couple other oils, or rosemary, and to diffuse those, and that is what's really good for congestion. And there are several oils if they are epileptic you can't use. There's several oils when you're pregnant you can't use because they're hormonal based and stuff like that. And there are a few, like wintergreen, I know for certain you cannot use on children under 2 years of age because of the, what's the chemical? I just read it earlier.
It's the same reason why you can't use it when you're pregnant.
Yes.
Yeah.
Anyways, the chemical in it, in undeveloped lungs, can stop them from breathing. So wintergreen is an absolute no-no on young children, and I know that for a fact. I've read that over and over and over again, and everybody I know doesn't use wintergreen on their small children. So, yes, and there's a whole lot of people teaching classes right now that tell you essential oils are 100% safe, you can use as much as you want, just lather them on and pour them on you. That is not true. Essential oils are very strong, and they need to be used with caution.
Here even says,
I'm sorry,
here even says you need 1 drop.
1 drop. 1 to 2 drops in everything you do.
Yeah.
And like if you're using an oil for pain, start with 1. If you need 2, go to 2. If you need 3, go to 3. But chances are you're not going to need more than that, just because they're so concentrated. Okay, so we're going to move on to constipation. Now this can be for babies or children. They recommend peppermint, 1 to 2 drops clockwise on the abdomen. Children, usually peppermint neat on the belly is fine. The younger the child, I would recommend putting the carrier oil with it. And then digest. Dilute 1 to 1 or neat on the lower abdomen and feet. And again, the younger the child, the more apt I would be to tell you to use a carrier oil, because the younger they are, the more sensitive their skin is. And then the last one for constipation is fennel. You can apply it neat to the feet, in the center of the heel, in the center of the foot and the heel. I'm sorry, I misspoke that. All right, for coughing, I'm going to recommend lemon and purification. and you're gonna diffuse either or both of them together for 15 to 20 minutes before bedtime. So I would recommend actually putting it in the child's bedroom, getting it going. So when they go in there, the air is nice and clean, it's got the oil in it, and they immediately start breathing it. Helps to calm that cough down. And then peace and calming, a few drops on their chest with a carrier. Okay, for a crying baby, they recommend peace and calming, neat to the feet and the back of the neck. And then have the baby smell the oils from the parents' hands. And then again, lavender and joy. Have them smell that from the parents' hands or diffuse it. Okay, for diaper rash. First of all, you want to avoid any irritants, which would be products you're already buying that contain talc or mineral oil. They recommend Gentle Baby, dilute 1 to 30 and apply to the location. And then Young Living has a product called Tender Tush Ointment, which is designed for diaper rash. And you're going to apply that topically to the area.
That one smells so good.
And these are all oars. So just as I'm going through these are several options you have. Animal Sense Ointment, which again is not just for animals. You used that on Issa, right? And it worked really
The
well.
Animal Sense worked better on her than the Tender Tush, but I think it's because Animal Sense was thicker,
Mm-hmm.
so it provided a little more protection that way too. And the Tender Tush is a little more runny.
Okay. And then they also recommended the rose ointment. And they do also give a recipe for your own ointment if you'd like to make it. It's 2 ounces of the rose ointment or coconut oil. Gentle Baby, 4 drops. Lavender, 2 drops. German chamomile, 2 drops. Cypress, 1 drop.
What, cypress, how many?
1 drop. And Melrose, 1 drop. And then this is German chamomile. You can go ahead and pass that around. It's different. It's not one I
I'm pretty
dislike.
sure that one's an Animal Sense.
I think you're probably right, because now that you say that, you can smell that.
I just got some of that for my.
German
Stop.
chamomile and Roman chamomile are very, very different.
What's that one? So I remember I opened it up and went blue.
Yes, it is blue, and it will stain things blue. Any of your blue oils, don't get them on your clothes because they do stain. Your Valor, German chamomile. What's the other one that's blue? Blue tansy. Don't get them on your clothes. Doesn't come out. All right. Then they also have some recipes for baby powder alternatives. They recommend 2 tablespoons of cornstarch with 5 drops of your choice of essential oil. They recommend either lavender, rose, or Gentle Baby. And then you just sift it all together so the oil gets distributed evenly throughout the cornstarch.
How many drops?
5 drops. Says you can use all of them or one, whatever your choice oil is.
Just 5 drops total though.
5 drops total with 2 tablespoons of the cornstarch. Bless you. Baby oil alternative. Mix 2 tablespoons of hazelnut or almond oil or olive oil. Sorry, I didn't read further. Then you also have the V6 alternative that the company sells with 5 drops of lavender or Gentle Baby. And the next recipe is for baby wipes. I don't know if any of you buy the Balance Complete, the the Balance Complete and Power Meal come in about the same size of container. Now you can't get the gigantic rolls of paper towels. You gotta get the smaller rolls of paper towels. They're about that big around. Cut it in half. You're gonna pull out the cardboard out of the middle. You squeeze it down and press it into here. And then you can pull straight from the middle and they're gonna come out one sheet at a time. In a separate bowl, you mix 2 cups of distilled water, 2 tablespoons of the Young Living Lavender Shampoo or the Kids Scents Shampoo, 2 tablespoons of the B6 or any carrier oil you choose. I would not recommend coconut oil for this because it's going to re-solidify. So that is the one time I say stay away from the coconut oil because you're going to have chunks in it if you use that one.
What'd you say after the shampoo? 2.
2 tablespoons V6.
Yeah, 2 tablespoons B6.
Or a carrier oil, you're saying, of your choice that
Yeah.
stays
Yeah,
liquid.
either almond or there's sesame or whatever oil you
Got
choose.
that pumpkin seed oil
Well,
already
and
in
that
my
one's
cart.
really good for the skin, so that'd
Oh,
be
yeah.
a fantastic one to use too. And then 5 drops of your oil of choice. They recommend either lavender, gentle baby, sandalwood, or frankincense. Now that's also a great way to just make wipies for the car too. I save every container that I get of the Balance Complete and I make a new jar of wipes, and every one of our vehicles has a container in them as well as the house. So when you're out traveling, that lid stays on really tight. It can slosh around all at once in the back of the truck, but you always have something to clean up with if you have it. Now my wipes that I use for the car, my kids are older, I usually use the Thieves Cleaner on it. And that works just as good. And what do you like? All right, diarrhea. And this is gonna kind of go along the same lines of constipation. It's the Digest, 1 to 2 drops on the abdomen. Then lavender and basil, both are antispasmodic.
That first one was 1 to 2 drops.
On the abdomen of Digest.
Digest.
And then the lavender and basil, it was 1 drop of each on the abdomen to reduce stress, which would be stress to your intestines, stress to your colon, that type of stuff. Peppermint, 1 drop orally. And of course, that would be for an older child. You wouldn't use that on a baby because peppermint's going to be quite strong for a baby to have 1 drop of it orally. Let them apply 1 to 2 drops on the abdomen. Let them, L-E-D-U-M. 1 to 2 drops on the abdomen. And then geranium, sandalwood, and Roman chamomile, 1 to 2 drops of each on the abdomen. And again, you're gonna judge that based on the age of the child. And this is Ledum, in case any of you have never had that one,
Geranium, sandalwood.
and Roman chamomile,
Those last 3 were 1 to 2 drops.
each on the abdomen.
Okay.
Not too much.
Well, there you go.
He's on with these.
Okay, we're gonna speed this up. Ear infections. Ledum and Melrose. Ledum or Melrose, I'm sorry, not and. Dilute 1 to 10, so 1 drop of oil to 10 drops of carrier. Apply 1 or 2 drops of this mixture around the ears, down the neck, and down the feet. And you'll do that several times a day. thieves, apply 1 or 2 drops on the feet. And you can dilute that if necessary. Okay, now oils are safe to use just about anywhere in the body, but putting them internally in the ear is the one area that they recommend that you don't do that. But in the Gentle Babies book, they say for extreme cases only, as mentioned previously on page 22, it is not recommended to place essential oils directly into the ear canal. There is an exception, but only under the following guidelines: restricting the use of a pacifier, eliminating all milk consumption, including raw cow or goat milk, making sure that the bowels are working properly, meaning 2 to 3 times a day, and the above mentioned oils on the outer ear fail to relieve the pain and discomfort. It says to use the following recipe with confidence, making no substitutions or exceptions for safety and effectiveness. Mix the following in a 1/4 ounce or less dropper bottle. V6, 10 drops of V6, or cold pressed olive oil, 1 drop of lavender, and 1 drop of Melrose. And it says to use 1 drop of this mix in each ear 1 time per day. And it's rarely needed beyond 1 day. So it's very, very diluted, and you're only doing it once a day. So that's one thing that's really, really important.
I'll call you on that one if it gets to that point.
Yes, well, and this is, I've never seen it in any of my books to where you can make an ear drop.
You can
Um,
use breast milk too.
You can use breast milk in the ear too?
Yeah.
Oh, see, for pink eye, they have using the breast milk for pink eye, but I haven't heard the ear. Thank you. It's good to know. Okay. This is one she needs to hear, so I'm going to skip this one and come back. Fear. Most children go through a episode in their life where they're very fearful. My children did it around the ages of 4 and 5. Always happened at bedtime, always happened at dark, very, very terrified. Nothing ever sparked it, it's just they start to become aware of things happening around them and fear starts to come into their life. So they recommend Valor on the feet and to diffuse it for children. Now there's other protocols for adults, but for children that's what they recommend. For fever on a baby. Now there's a different protocol for baby and child, so we're going to start with baby. Peppermint, dilute 1:1 and apply to the navel. I have also used peppermint on feet, but my children were older, so this is what they say for babies. Lavender, 1 to 2 drops on the bottom of the feet. And thieves, 1 to 2 drops on the feet.
That's for babies too?
Yep.
I've just done peppermint and lemon together, and that works really well too.
Lemon? Very good. Now for a child, they say the peppermint neat on the navel instead of diluted. This is for fevers.
Okay.
A baby would dilute 1 to 1 peppermint on the navel. A child, it's neat. Then it says lavender and thieves, 1 to 2 drops on the feet hourly. This is for the child. And then 1 ounce every couple hours of Ningxia red. Now I don't know why they skipped over the thieves. I would also do the thieves as well on the child as you do the baby, but for some reason they didn't mention.
Yeah, you said lavender and thieves.
Oh, together, that's why. Thank you.
1 ounce every hour
Every couple hours.
or of the Ningxia.
The Ningxia red, yeah. I'm gonna pop back here to eczema and dermatitis. I skipped this because you were out of the room. Lavender and Melrose. Place 2 drops neat to the affected area. Says to use a tender tush like lotion and apply it all over the skin. Detoxine or Allerzyme, which are both supplements. Allerzyme is more for allergies. Detoxine is kind of to help to detox the body. Says to use either or. Empty the contents of 1 capsule in the food. And that's for young children who are eating foods, not nursing still. So if the child is simply nursing, that would be an option that you couldn't do. But once they go into the baby foods, as long as they're eating foods, they're good to do that. Says to apply lemon neat to the affected area. Mix lavender and rose ointment, a few drops of lavender, and apply it to the affected area. The lavender hand and body lotion, so to slather the skin with that. And then we have an irritated skin ointment that you can make. It's 2 ounces of the rose ointment, 2 drops of lavender, 2 drops of German chamomile. I'm sorry, that was 1 drop of German chamomile. I read the line above it. Cistus, 1 drop. 3 drops of palmarosa. 2 drops of geranium. And 1 drop of helichrysum. And I was supposed to bring helichrysum, but could not find it. So there's the palmarosa and the geranium. Okay. I'm going to skip a few of these because they're kind of similar to ones we already did. Insect bites. They're very similar. So for insect bites, purification, which is my #1 go-to for insect anything. 1 drop on the bite. For prevention, you can do 1 to 2 drops on the feet daily. And then they have a recipe for an insect repellent that is safe for babies. For every 4 ounces of distilled water, and you want to make sure you get distilled water because that's water that's been boiled and has nothing left in it. So if you're going to make any type of spray, that's typically the water you want to use. Add 5 drops of purification and 5 drops of peppermint. Some variations that you can do, you can add Palo Santo, which is good for bed bugs. Idaho tansy, it's good for flies. And I don't know why they put this on here again because it already has peppermint in it, but it says peppermint's really good for ants and spiders. Okay, insomnia. Lavender, peace and calming. 2 drops of each on the feet at bedtime. And then also diffuse 30 minutes before bed. All right. Anybody need to know about jaundice?
Kind of.
Okay.
What he was.
Yeah, it says 1 drop of
This is
digize.
what he was again, like newborn. Yeah.
1 to 2 drops of digize on the feet. You probably want to do a carrier just because they're younger, but typically digize isn't an oil you have to dilute. And then it's just place the baby near a window or go for a walk for at least 10 minutes of direct sunlight a day.
Unless it's during an ice storm.
Right?
Right.
Need to be in the window then. All right, pink eye. Most of us have had problems with pink eye with our children. You want to always make sure your hands are clean before you address it, because any type of bacteria getting in there just makes the body work harder. If you're still nursing, you can express 1/2 ounce of breast milk and apply 1 to 2 drops into the affected eye. Melrose and lavender, 1 drop of each, plus 1 drop of olive oil.
You said Melrose and lavender, right?
Melrose and lavender, 1 drop of each, with 1 drop of olive oil. You're going to mix that in a sterile container, either a plate or a bowl, something you can cover up, because you're only going to use a small amount of this and it'll last for several applications. You're going to use a very small amount, and you're going to massage it on the outer bone of the eye, all the way around the eye. So you're going to go that whole eye socket, down the bridge of the nose, and above the eyebrow, and the temple. There should be little to no residue left on the skin when it's done. Avoid direct eye contact. It's best to do it at nap time and bedtime. Ringworm, another very common thing that happens to school-aged children. Melrose neat on the affected area. And then they recommend using the thieves cleaner to clean everything, including sheets and clothing. Teething. Thieves, dilute 1 to 5 and apply to the gums. So 1 drop of oil to 5 parts of carrier oil. Then it has the Exodus 2. I have never smelt Exodus 2 nor tasted it, so I can't. The Thieves isn't a bad flavor. Exodus 2, I have no idea what it's like. So it says to apply 1 drop several times a day to relieve pain directly to the gums. And then clove, dilute 1 to 5 and massage on the gums. It says for an older child, you can use the pan away or deep relief and actually apply that to the jaw area where the tooth is coming in at, but they have to be an older child to do that. So I'm thinking molars coming in, wisdom teeth, stuff like that, and you can apply that back here.
And you said pan away or what?
Deep relief. Still dealing with umbilical cords?
He's 4 months old.
Well, umbilical cords for future. Myrrh, dilute 1 to 10 and apply it to the end of the cord. Frankincense, 1 to 2 drops a day on the cord. Geranium, 1 to 2 drops for any bleeding that's happening around the cord. And that one can be diluted. And then they have an ointment you can make if you would like. It's 2 ounces of the rose ointment, 1 drop of lavender, 1 drop of frankincense, and 1 drop of myrrh. All right, last one, ladies. Vomiting. Recommends Digize on the abdomen. And then 1 drop on your finger and rub it on the inside of the cheeks. Thieves, and ingest 2 to 4 drops in water, breast milk or almond milk.
2 to 4 drops.
How much water? Like a cup?
Whatever you want. It's more just to make it tolerable to drink. So depends on if your kid's older and wants to drink it real fast, or if they're gonna sip on it probably.
Water, rice milk, or what?
Almond milk. Also apply the thieves to the feet. And then sandalwood, 1 to 2 drops on the abdomen.
Nothing for ginger?
Nothing for ginger for vomiting.
Surprise me.
I don't know if ginger's maybe one they don't recommend for children. Did
Maybe.
you look on there, on that sheet?
No, I
Because
didn't.
nothing in the book says
Yeah,
anything
well,
about
ginger
ginger.
lily, it says.
It says what?
Ginger lily?
Avoid topical use on under 2.
Yeah. And that's probably why they avoided
And
ginger.
then the sandalwood, sorry, that was 1 to 2 drops on
And
abdomen
the
as well.
abdomen. I'm sorry, I didn't see this one. ADD and ADHD. This is out of the Higley book, because they did not even mention that in the Gentle Babies, which really surprises me. Lavender, you can use it topically or aromatically, which would be diffusing it. Citrus Fresh, topically and aromatically. Rutavala, topically, which I would recommend the feet. The feet's a direct line into the bloodstream. Anytime something doesn't tell you where to put an oil, the feet is a good place to put it. It's also, the skin's a little bit tougher, so it's less likely to have any form of reaction to it. Tranquil, topically. Ledum, topically and aromatically. And then you can blend lavender and basil together and put it on the crown of the head. Harmony, which is one of Young Living's blends. Peace and Calming, it's another blend. Basil and Clarity. And Frankincense with Valor. Says apply 1 to 3 drops to the feet and the spine. The feet and the spine. It's getting late. And diffuse. I did also hear that vetiver is supposed to be very good for ADD and ADHD. I have a friend who uses it frequently and it works very, very well. But that's just something that she kind of found on her own. So it's not necessarily in a book that I found.